So your lungs are doing well. Any abdominal pain or chest pain?
Dr. Samya Nasr began working at the University of Michigan Cystic Fibrosis Clinic in 1989 as a fellow. It was an exciting time because that is when Dr. Frances Collins discovered the gene that causes CF. In 1993, she became the center director. Back then, there were 60 patients, and now there are 300. Looking back, she remembers how excited doctors and patients were when Pulmozyme was introduced. It made a big difference in patients' lives and still does.
Pulmozyme was the first drug that was done for cystic fibrosis, and it was unbelievable. Patients were calling, they wanted to enroll in the study, and it was very exciting to see something that's created specifically for CF.
So much has changed since then, with Kalydeco and Orkambi introduced by Vertex, now being taken by CF patients, and there are more drugs in the pipeline that are giving CF patients a longer life. The biggest challenge? Adherence.
Try to explain to them what the benefit of each medication, and we also work with them with time management, giving them some leeway of how far medication can be from each other. It doesn't have to be 12 hours. If it's twice a day, it could be 8 hours or 6 hours. So a lot of flexibility we try with them.
In the 1980s, patients looked sick, and Dr. Nasr says the quality of life was not where it should be. In the 90s, they became more aggressive with medications and increased the amount of times patients should come into clinic. Now patients are transitioning to adulthood.
Now you see teenagers, you're transitioning to adult. Nobody can see that they have CF. They don't show it. They're functional. They're doing well. They go to college. They have careers. So this has been very exciting. Are you active in school? You're playing. You're doing the gym classes and all of that.
Dr. Nasr says she expects her CF patients to play sports and live as normal a life as possible.
CF patients, we always have to be positive. And it's not that we're denying what the problem is, but at the same time, okay, yeah, you have CF, you're living with CF, but how can you live with CF and have your normal life as you would want? So it's very important to work with them and make sure they understand that I expect you to play football, I expect you to go to modeling school, I expect you to do whatever you want, but you need to remember CF and you need to do your treatment every day.
In the United States, CF doctors treat patients with state-of-the-art medications. While there are challenges along the way, doctors are optimistic that the life expectancy of 41 years will continue to grow. Dr. Nasr, who is from Egypt, has been traveling to Cairo University since 1997, asking doctors to test patients for CF. And they told her there's no CF in Egypt.
I've been going every year, and at that time they said, you can talk about CF as an interest, but we don't have it. And every year I go, I talk about CF, and finally they just give in, and in 2007 they start testing.
Right away, they diagnosed 60 patients, and now between two universities have diagnosed 200 patients. Dr. Nasr says it's like stepping back in time medically. They don't have all the drugs needed to treat the disease. They have to adapt with other drugs, and they're expensive. And a common problem with CF, failure to thrive, if that happens, they are not equipped to handle it.
If you have a tube feeding, the care for it there is not really ideal yet. So there is a lot of deficiencies. It reminds me of CF in the 50s and 60s here.
Recently, when Dr. Nasr was speaking at a regional conference in Egypt, 3,000 doctors and medical staff attended, along with families that sat in the back. They came to tell her how their kids with CF were doing and to ask for advice. Dr. Nasr says, sadly, how well a CF patient does in Egypt depends on how much money the family has.
The well-to-do, they probably will live till their late teenage years or early 20s. The poor or the limited resources people would live till maximum 10, 12.
Dr. Nasr told us about one boy named Yusuf who was failure to thrive and would have lived past 10 years old if he would have received the care offered here in the United States. Her dream is to start the first CF clinic in Egypt.
All right. Thank you. No problem.
I'm Laura Bonnell. To learn more, you can go to thebonnellfoundation.org.